The TENEX Health TX system was designed for quick and easy setup and programming. The TX system console comes in a travel case with the following components: a console and a foot pedal. In the system accessories box, you will find a power cord, a reusable inflation cuff, extra fuses, an operator's manual, system setup card, and a protective vinyl covering for the console. The disposable TX procedure pack includes 2 trays which contain items used during the procedure. The instructions for use, post-procedure patient instructions, and physician dictation template are packaged between the trays. The TX supply kit contains pre-packaged sterile items for use during the procedure. Each item should be opened and dropped or placed on the sterile field. The tray includes ChloraPrep, a 10 cc disposable syringe, 2 23-gauge needles, latex-free probe cover kit with sterile gel, a number 11 scalpel, 4x4 gauze sponges, elastic skin closure strips, and a transparent film dressing. Additional items needed include 1 bag of normal saline, 10 to 30 cc vial of local anesthetic, and a compressive dressing such as an ACE wrap. The TX microtip cartridge system is sterile and sealed in the remaining tray. To set up the TENEX TX system, place the console on a flat surface and lift the screen. Insert the power cord and foot pedal cable into the back of the console. Turn on the console by pressing the power switch on the back panel to the on position and wait for the main mode screen to appear. Insert the air tube fitting on the inflation cuff into the air receptacle on the side panel by twisting clockwise until snug. Insert a saline bag, 250, 500, or 1000 cc's, into the inflation cuff. Rest the cuff with the saline bag on a flat surface near the console or hang it from the side of the cart if available. Do not place the saline bag on the console behind the screen. The next step is to insert the cartridge and connect the handpiece to the TX console. You will need the TX microtip. Wearing sterile gloves, remove the handpiece and cartridge and place on the sterile field. Carefully remove the cartridge and upper portion of the tubing, leaving the microtip and remainder of the tubing on the sterile field. Ensure the aspiration tube is aligned properly within the groove on the bottom of the cartridge. Next, insert the cartridge into the side of the console, pressing straight down firmly until locked in place. You should hear an audible click when you lock the cassette into place. Align the recessed arrow or red marker on the TX microtip electrical connector with the colored dot on the console side panel cut receptacle. Then insert the connector into the receptacle. Spike the saline bag. To prime the system, begin by putting on 1 sterile glove. With the tip cap on, hold the TX microtip handpiece in a vertical position with the needle pointing upward. Select the Prime key on the TX console. A successful priming cycle will be indicated by the message, "Priming successful." After successful priming, leave the tip cap on. Select irrigation to On, aspiration to medium or high, and cutting power to medium or high. Depress the foot pedal for a few seconds to test for the acoustic signal. Reset the cutting time clock by pressing the cutting time key. Place the handpiece back on the sterile field until ready for use. To shut down the system, select Off for irrigation, aspiration, and cutting power selections. Turn off the console by pressing the power switch on the back panel to the off position. Remove the saline bag from the deflated inflation cuff. Do not discard the inflation cuff. Remove the spike and discard the saline bag. Disconnect the TX microtip electrical connector from the cut receptacle on the side panel. Depress the cartridge release button and remove the cartridge from the side of the console. Cut the tubing with scissors at the base of the TX microtip and dispose of the TX microtip in a sharps container. Dispose of the cartridge and remaining tubing according to facility regulations. Before cleaning the console, be sure that the AC power input has been disconnected. When cleaning any external surface on the console, use only isopropyl alcohol 70% or a mild soap and water solution and a soft cloth. Do not use bleach or corrosive solutions. Never spray cleaning solution directly on any part of the console. And finally, use only 70% isopropyl alcohol to remove soil from the touchscreen.